I would like to invite to the stage Cassandra Thiel. Cassandra is assistant professor at the New York University, Langone Health and Sustainability Consultant. And Cassandra comes from the world of academia and is doing research on environmental performance of medical system, hospital design, health practice, and medical technologies. So is trying to look into how actually those healthcare systems can perform better and be more sustainable, bringing also great outcomes to people, right? And Cassandra will talk about the cross-sectoral partnerships for health. Thank you.
All right, thanks everyone, and thank you for having me. Hopefully you're all doing okay. I feel like I should get you up on your feet and you jump up. Yeah, do it. If you need to, I'm not offended. It's been a long day and I haven't even been here the whole day. So I'm here today to talk about establishing multi-sector stakeholder partnerships. What I really want to share is just that there is a lot of reason to hope through all of this, and I think there's a lot of reason to be excited. So how many of you have enjoyed like Lord of the Rings? Some of those epics, right? We're in that epic right now. We have a mission and each one of us is, well, maybe not Frodo, maybe somebody else in there, but we each have a role here to change things for the better. This is a big opportunity, is really what climate change is. We have to change everything, including health systems. So this is my conflict of interest statement because I present to a lot of medical audiences and this is something we have to do. So I'm a paid consultant for a variety of medical facilities, medical device manufacturers, and I do that work proudly. Having a foot in academia and a foot in consulting allows me not only to think about the philosophy behind all of this, but to actually look at the practical, where the tires meet the road kind of thing. What can we do to drive change? Academia is not necessarily the best place to do that. No offense to academics out there, but if you're doing climate work, it's got to have some practical influence. Otherwise, what's the point? I also have the biggest conflict of interest ever. I have an almost 3-year-old, and I want him to live on a livable planet. So I will do absolutely anything to ensure that, including talking to you all and hoping that this motivates you to do whatever you can do to make a more sustainable planet. So we heard a little bit about the footprint of healthcare. Globally, about 5% of our greenhouse gas emissions are coming from the medical space. In the US, we're a little better, meaning worse. So we spend a lot more on healthcare, of course, and that actually results in higher emissions per capita and on the whole. So here you can see 8.5% roughly of our country's emissions are coming from the healthcare sector. We emit a lot in the US, so if you took US healthcare out of our country, made its own country, it'd be the 13th largest emitter in the world. So healthcare should not be excluded from the decarbonization goals. It's a major factor here. And there's also the kind of sad irony that the work that we're doing to provide medical care is actually causing patients to need medical care. This should not be the case. We can definitely do better. So the work that my lab is doing, the work I'm doing as a consultant, is using tools to footprint healthcare to look at where the emissions sources are coming from and to try to determine ways of mitigating that and even adapting to climate change. Because right now, we know healthcare facilities are struggling even to address issues with climate change, whether it's fires or hurricanes. Hospitals are shutting down, supply chains are breaking down. It's becoming more and more a challenge to provide care, at least the way that we have been historically doing this. Every country has a slightly different profile, and I would also like to say to the global audience out there, those of you in a more developing context are actually probably doing all right on sustainability. I've worked with healthcare institutions in India who have amazing outcomes for their patients, but are doing, say, a cataract surgery at about 5% of the footprint for the same procedure in the UK. Right, so there are lessons to be learned here, especially by the wealthier countries, more westernized countries. We can do better, and the models already exist for doing so. It's just a matter of implementing them. How many of you are familiar with the greenhouse gas reporting protocols? Okay, a few. So basically what this is for an organization, a company, even a whole country, quite frankly, if you wanted to go that far. You can scope out your environmental emissions, your greenhouse gas emissions, so basically like a carbon footprint. And the way that it's divvied up is in scopes 1, 2, and 3. Scope 1 are your direct emissions, so anything you're burning on site, right? If we have a diesel generator running here, that's our responsibility, we're emitting that. For healthcare facilities, they don't emit a lot of Scope 1 emissions. Especially in the US, we've removed a lot of incinerators, so they're not burning garbage on site as much. Greenhouse gases that do come from the healthcare system directly, though, are anesthetic gases. So if you've ever had a surgery and they've put a mask over you and you've been knocked out, those are some pretty potent greenhouse gases. And so healthcare systems directly emit those, and they may be generating some electricity on site, which could result in some direct emissions. But on the whole, it's a service sector, so there's not a lot of direct emissions. Scope 2 emissions are any purchased energy, so electricity especially. Healthcare facilities are great consumers of energy. I think here in the US, hospitals are the second most energy intensive building type, just behind food service, where you have a lot of refrigeration. But you think about a hospital, it's basically a mini city, right? They're doing a whole bunch of stuff on site. They have a lot of different types of refrigerators. They're using lots of air in their operating rooms that has to be heated or cooled to a certain temperature and humidity. Just a lot of energy consumption to provide that care. The final scope here, Scope 3, as you'll notice from the diagram, is probably the largest, right? This is pretty much everything that your organization could possibly influence. So your supply chain, all the upstream manufacturing impacts from anything you're purchasing, all the waste treatment downstream from your facility. It also includes things like investments, which is an interesting world that I don't delve a lot into, but healthcare facilities can have some pretty carbon intensive investments. It's also rented facilities, rented services, commuter travel, conference travel, right? All those kinds of things that your company could be encouraging or supporting or mandating. And typically when organizations make carbon reduction goals, they're focused on Scope 1 and 2, because those are things that you can easily control, relatively speaking. Scope 3 emissions reductions are harder because you suddenly have to partner with other groups. So a healthcare system, a majority of their emissions are really coming from those Scope 3 emissions. So let me go to this slide here, which gives you an idea of the US healthcare system and its emissions. So you can see Scope 1 and 2 at the bottom there, the light bluish colors. The darker blue are all your Scope 3 emissions for the healthcare sector. So pharmaceuticals are a big part of it. All of the supplies that we procure, we use a lot of single-use disposable items in healthcare. That's something that's harder for a healthcare system to control, right? We do need pharmaceuticals. We do need single-use supplies, though I would say that we don't need as many as we're using. And so that requires some industry collaboration, right? So I work with a lot of health systems to try to figure out how we can best manage these things. And we don't have all the answers yet, but we do have quite a few interesting solutions. So for healthcare providers, there's certainly a lot that they can do on an individual basis and to try to get their healthcare systems on board. And it really comes down to reduce, reuse, recycle. So you should reduce what you're using, right? Don't bring it in, that's the best solution. And there's a lot of ways that we waste materials without even using them in a healthcare system. Administrators can set up their own policies and advocate for better protocols. Product manufacturers, this is a group I really want to get on board. These are global supply chains, and there are much better solutions out there for products that you can develop. You can servitize the industry too, so it's not so much single-use disposables, which have issues with their adaptation, right, when it comes to supply chains. As we saw during the pandemic, PPE, protective equipment, was really hard to source. If you had reusable PPE, it may not have been as difficult. And governments certainly have a large role to play here. A lot of the emissions from across these supply chains are coming from energy sources, right? So what are we doing to try to encourage green energy? And there are a lot of regulations, particularly in the healthcare space, that have impacts here as well. And there are many other stakeholders I have not mentioned. This is a complex system, certainly in the US and abroad, and everyone has a role to play. So I'll leave it at that. I look forward to your questions later on. Thanks.
Thank you, Cassie, for sharing this. And then we are deep diving further into this topic. I would like to welcome Shane Dunne, who is Associate Director, Sustainability at Memorial Sloan Kettering Cancer Center. And Shane leads sustainability programs. So it's actually like managing all those projects and initiatives, partnerships at the hospital. So we'll share really like experience from the field. Please.
Thank you. Happy to be here with everybody today in the room and virtually. So Shane Dunne, I lead the Sustainability Program and Department at Memorial Sloan Kettering Cancer Center right here in New York City, and really looking to take kind of a deep dive into the structure of our program framework, because this is widely applicable in terms of the focus areas in our framework. In terms of looking to reduce the environmental impacts of healthcare, we have a long-standing commitment to sustainability at Memorial Sloan Kettering. We take a three-pillar approach, advancing environmental, social, and economic stewardship, really in alignment with our objective, leading and innovating sustainable practices, with that three-pillar approach for the benefit of our patients, staff, and community. So you see on the screen, comprehensive program framework, climate action and resiliency, energy and water efficiency, waste management reduction, sustainable sourcing practices, the design and construction of our buildings and capital construction to green building standards, even food and nutrition behavior changes, purchasing practices, stakeholder staff engagement, and really building an organizational culture around sustainability. People don't come to Memorial Sloan Kettering because we have an industry-leading sustainability program. They become because they're afflicted with cancer, and they're an immunosuppressant patient population that are the most vulnerable out there to things like climate impacts and health impacts. So what we do in this space is of the utmost importance. So a lot going on the slide here, very busy, but by design. We have tangible goals, smart goals that are set, aligned with our program framework to make sure we're holding ourselves accountable and tracking our progress in a data-driven approach across these different areas. Reducing the energy use intensity, so the energy used per square foot for all of our facilities, setting goals for that. Looking at the total waste that we generate, ensuring a specific percentage of it goes to at least a landfill diversion dedicated recycling stream, and that we're not generating any more than a certain percentage as regulated medical waste because of the intensive end-of-life impacts. We design all of our buildings to green building standards, lead the U.S. Green Building Council Leadership for Energy and Environmental Design, comprehensive sourcing standards. So when we're working with suppliers, we're taking industry best practices, talking about eliminating materials of concern. You heard from David about really that bioaccumulation and some of those disturbances there, ensuring that we're eliminating those from healthcare supply chains, working collaboratively across the industry, and various things in our supplier relationship management processes. We even have a paper reduction program, really leveraging digital capabilities to reduce often antiquated paper processes, because not just the purchasing of paper, but storage of paper and the transportation of paper, the toner that we have to buy, the usage of the toner, the disposal of the toner, the procurement of printers. When you start thinking with that life cycle approach and things like that, we look to reduce our environmental impacts while promoting and preserving population health, driving community benefits, saving costs for our organization, and ensuring that we have staff recruitment, retention, and satisfaction, because they're really demanding, especially the younger generations that we do so. So we work through these things like food and nutrition practices and stakeholder and staff engagement, and we have specialized committees focused on the laboratory and the operating room environments. We also have dedicated climate action and resiliency goals, so thank you to Cassie for giving you a climate competency that I don't have to kind of work through in my few minutes here. But we have set goals aligned with the Department of Health and Human Services, Healthcare Climate Pledge, reducing our Scope 1 and 2 emissions 50% by 2030, while still charting a roadmap on achieving net zero by 2050. Lofty goal for sure. Inventorying our Scope 3 emissions, because in our supply chain stuff, we don't know what those emissions are yet. So we're really doing deep dives, working collaboratively with industry to try and find those emissions, find those really intensive hotspots for where we can action it within our program framework, working collaboratively across the industry to reduce. and develop a risk assessment and climate resiliency plan for continuous operations. Climate affects human health. Climate affects our ability to deliver continuous care. When we do, I'm a big fan of the climate and approach. We're going to reduce our energy use intensity, save money, and reduce our climate impacts. We're going to educate our staff on making more cognizant food choices, choosing plant-based foods for their health, and reduce our climate impacts. We're going to look at our fleet vehicles and transform our fleet into either EVs or alternative vehicles and smart shipping for our different routes. Save costs, fuel costs, and reduce our climate impacts. So these things are really smart business cases when we end up putting them together. And that's how we've been executing really on this for over 10 years at MSK. So the call to action couldn't be more apparent. Turn on the TV, extreme weather events, everything that you're seeing. Clinicians and we in healthcare have an outsized impact on the climate. You heard the statistic, US healthcare makes up 8.5% of total US-based greenhouse gas emissions, and the US-based healthcare makes up close to 27% of the global healthcare footprint. We don't treat 27% of the world's population. It's because we have intensive impacts in our delivery of care for sure, but the industry is catching up and the call to actions are there. Medical journals, over 200, Lancet, New England Journal of Medicine, call to action after COP26 about what we need to do to keep average global temperatures down below 1.5 degrees Celsius. So as I mentioned, climate has tangible impacts on health. It really exacerbates vulnerabilities in our populations, and we as healthcare with a vulnerable patient population and the need to deliver continuous care and ensure that we're mitigating those health risks for our patients need to do everything we can, and we're looking to do everything we can to mitigate our climate impacts. And because you saw goals but not much progress, we've reduced our scope 1 and 2 emissions close to 47% since our baselines that we've put forth. We've reduced the energy use intensity of our buildings at MSK 58% since our 2007 baseline just last year. So we're doing what we can, but there's a long way to go and a lot of collaboration in the industry. And I appreciate the time coming up here and giving a hopefully practical use case.
Thank you so much, Shane. I think this was very inspirational and informative at the same time. And now, so we heard from the hospital manager here in the US, and we will travel now to Africa, to the rising continent, and hear from Toseef Dunne, who is the CEO of the MP Shah Hospital, who is joining us online. Hi, Toseef. Can you hear us?
Hello, Carolina. How are you?
Hi. Great to have you with us here. I think it's pretty late now in Kenya, but we appreciate you being with us today, virtually joining to share your experience about greening healthcare in Kenya. I talked to you a couple of months ago, and you shared your experience being pioneer in this area and inspiring the others. So please share your story with us. Thank you.
Thank you. Thank you, Carolina. And greetings to everyone from Africa, from Nairobi, Kenya. My name is Toseef Dunne, the CEO of MP Shah Hospital. It's almost coming to midnight, but happy to be here with you all. Kenya, of course, is a beautiful country set in the beautiful continent of Africa with, of course, great mountains that I invite you to climb. And of course, a country that is associated with the world's fastest runners. Closely knit in this country is the MP Shah Hospital. And this hospital is a private hospital, 217-bed hospital, ISO certified, and it's ranked as one of the top 3 hospitals in the country. I do hope that one of you are going to get a chance to connect with me when you come here to Kenya. But I think the purpose of this presentation here is to tell you, what does our green journey look like? So the green journey started in 2019, and this idea actually came to me in a forest. And as I was walking down this forest, and I thought to myself, this forest is so beautiful, it's so protected. How can we have this sustainability agenda moved to healthcare? as my previous speakers mentioned, that if healthcare was a country, it would be the 5th largest emitter of carbon. And with all that in mind, I think one thing that really sets the tone is that healthcare industry is an industry that is associated with very high infection prevention control standards. And it's one of the unique industries that has all the waste streams. And when I say all waste streams, it means radioactive, biomedical, laboratory, chemical, and atomical waste. It has all the waste streams. And if you look at the carbon footprint of healthcare, it is 4.4%. Global healthcare footprint of healthcare only is 4%. So in 2019, we took in some very baby steps. Here in Kenya, we don't have vulnerability assessment reports. Neither do we have any mandatory sustainability frameworks or reporting that is enforced upon us by the regulators. So this was an entirely voluntary effort. I solely and firmly believe that sustainability is a team sport. So in 2019, we launched the Green 365, and 365 means that we as a hospital community want to be green 365 days of the year. And we started with very simple steps. And that's my encouragement to everyone, that whenever you start a sustainability journey, break it down into very simple baby steps. And we started tree planting, and we launched a green policy book. In 2020, we formed a small Go Green committee, of course, mainly made of women. There's something with sustainability and women in healthcare. So about 80% of our team members were women. So we formed a Go Green committee. We installed Grow Green champions, and we even formulated our own green KPIs. In 2021 was a great year, and we became signatories to the United Nations Global Compact. 2022 was the first time ever that the MP Shah Hospital ever undertook an environmental impact assessment audit. We issued our first sustainability report, again, a voluntary effort. We had implementations of the findings. One of the great things that happened in this particular year, we launched 2 campaigns. One was the e-waste campaign, and the second one was textile recycling. We realized as a hospital, we had a lot of used laptops, cables, joysticks, so many old broken laptops. So we were able to recycle this through our e-waste campaign. As a hospital, we had a lot of linen. So we were able to recycle the linen through our textile recycling plant. 2023, just recently, as you may recall, we celebrated the World Earth Day, and we were the only hospital in Kenya to create awareness for greening healthcare. We are also the first hospital in Kenya who stopped using nitrous oxide. As you heard Cassandra mentioning, anesthetic gases are quite potent. So we stopped using nitrous oxide. We replaced this with medical air, and we continued with our tree planting drive. Again, this journey has been all formulated within. We don't have a sustainability manager. We don't have a sustainability department. These are all actions that we can do because sustainability is a team sport. We can do it if we really want to do it. Over the next couple of slides, this is our chairman who planted the first tree in our hospital. And I think it's so important for us to set the tone at the top. And if the chairman endorses something, I think it becomes very easy for us to break this down. And we continued with our tree planting initiatives. This is on us becoming, signatories to the United Nations Global Compact. We are firm believers of biophilic designs. The Hippocratic Oath for the doctor says, do no harm. So we should not be doing harm to our patients. And these are gardens within our hospital facility where patients can come, they rest, they meet their relatives, they have their refreshments here. And I think it really gives them a great space to be able to call this space their own. This is our bin, our used textile bin, which we have partnered with the Africa Textiles, our e-waste bin, where we are able to, dump all our bulbs and etc. that I mentioned earlier. During the COVID-19 pandemic, the fragile system of Africa was deeply affected, and we were buying cylinders from various suppliers. So we came up with an initiative, and we installed our own oxygen plant. That means that we were not buying cylinders. And I think that was quite a welcome move by us. We also installed rainwater harvesting units, something very simple, but we were able to conserve this water. We were able to use this to water our gardens, and we also installed solar panels. And really, in the way that we are doing sustainability, it's doable. It's something small that we are doing, but we've made a great mark. We have set the stage. We have been role models. And this is our staff celebrating the World Earth Day, where the theme was investing in the planet. In Kenya, our official language, of course, is English, but we speak a lot of Kiswahili. And in Kiswahili, we say asante sana, which means thank you very much for listening. That's all from me. Thank you.
Thank you, Toseef, for being with us and also sharing your story. And as you showed us on the pictures, there is so many different things that you do in so many different areas. I hope you can stay with us for until the end of the session. I would have some questions and maybe something like that you can share more with us. But now we heard like from Casey a bit more from the big perspective. Then we had the stories of the healthcare managers. And I would like to then go more with the two next presentations into the details or into some like cases, more detailed cases. And I would like to invite to the stage Chethan Sarabu, who is the clinical assistant professor of pediatrics at Stanford Medicine and director of clinical informatics at Sharecare. And I joined online the Chethan's event last week, and I actually listened and was like learned how much the inhalators, actually the use of inhalators and changing like which inhalators you use can impact actually carbon footprint or improve the performance of the healthcare systems. And Chethan says that his passion is medicine, design, and information, and he will tell us a bit more about that from the lens of informatics. So, Chethan, welcome.
All right, thank you very much for having me. So thanks for the warm introduction and welcome. And I'm here to give you a brief overview of the perspective of informatics and really looking at climate health through that lens. And just to add to the introduction, so I'm a practicing pediatrician, trained, board certified in clinical informatics, which is really the field of how people, process, and technology all come together. I'm also trained as a landscape architect and have had a long-standing interest in this intersection between environmental health and human health. And so when we look at these multiple intersections, there are so many different opportunities, and it's a very complex web. This was a diagram that we put together for the very first design workshop on informatics and climate health earlier this year. So in this diagram, you can see at the top, we see climate health, climate change, and it links to a growing number of effects on the general public, on public agencies, healthcare systems, and we're understanding more and more about the basic science of how heat impacts different conditions, how air quality impacts different conditions. We also know that there's links between the healthcare system and climate change that we've been talking about, the impact of the greenhouse gas emissions from the healthcare system. And so within this diagram, we see there are many opportunities for changing the way things work. There's a lot of work happening around trying to build more resilient systems so that the public agencies, healthcare sector is more prepared for climate change. There's the role of adaptive care. How do we help take care of people that are more vulnerable to different climate-driven impacts? There's the work of healthcare sustainability that you've been hearing about from the last few presentations. And there's also a lot of work still advancing our knowledge and understanding how different climate impacts and drivers actually affect disease and human health. And to break that down a little bit further, when I say an informatics lens, I wanted to just give a bit more of a practical example and context of what that looks like. And this is really a way of thinking that can help to break down complex problems and challenges like climate change and health. So informatics is really the intersection of people, process, and technology. And so if we take an example like an impending heat wave that is predicted to affect a community, when we look at it through an informatics lens, we take different stakeholders like a healthcare system, public health agencies, the general public, and look at what that means from a technology lens. So for the healthcare system, that can mean, how is this heat data coming into electronic health record systems and being used to identify those that are most at risk and what we could do about them? But then it's not just about the technology, but it's really the process. It's, where is this information going? Who can act on it? It's that process and people part that is often such a critical part of how technology gets implemented that is often overlooked. And that's really where the informatics lens really helps us to understand how to use technology in the real world. Within the same example of heat with public health agencies, there are a lot of challenges around data standardizations. How is heat being measured, and how is that then shared with all the different agencies that depend on that information? And similarly, what is that, and from a process perspective, what is the timeliness of that information? From the general public, from a technology lens, we might think about apps. A lot of us have smartphones that show us the weather information, that show us weather alerts. How do we think about that in context of a natural disaster that's coming in, and how healthcare systems are prepared for that? So this is just a very high-level example of how an informatics lens can apply to a climate and health challenge. And what this really enables to is a way of breaking this complex problem down. There are so many different opportunities and so many challenges that it can often feel overwhelming. And this informatics lens allows us to scope, to size, and scale how we might approach different interventions and to share them. It allows us to connect the dots. Data endures. The technology has a role to play in reducing impact, but it's also the social technology and networks and movement and impact that it can build and helping us to see what others are doing. And it can also help us to connect the micro to the macro. We talk about, oftentimes we've heard a lot of presentations on scope 1, 2, and 3 emissions and how we measure those. And you can get really into the weeds and details of getting very granular about how you're quantifying that, but then how do you connect that back to the big picture? And again, informatics tools, visualizations, dashboards, and how they're implemented can help with that. And finally, it's about catalyzing change makers. I think about this in the context of hospitals. We've heard from presentations from different hospitals in New York and in Kenya. There's a power of informatics tools with visualizations and other behavioral change nudges that can inspire and connect. And finally, I want to end with this slide where I just share some very practical examples. I know the text may be a little bit small, but just want to give you a very high-level overview, going back to that initial diagram, of these very practical opportunities. And this really connects with ECHA Alliance, not just the green health opportunity, I think, but streams across digital health. And so when we think about that first bucket of healthcare sustainability, there's a lot of work with quantifying scope emissions, with understanding the health benefits, the greenhouse gas reduction when we choose greener inhalers, greener anesthesia, choose virtual care over driving in person. But a lot of those different models and calculations all have different data inputs and outputs. And so there's a really big data informatics challenge of how do we start to standardize and quantify that and to disseminate and share that. When we think about adaptive care, people who are more at risk for certain conditions or diseases need tools. The clinicians who take care of them need to be able to say, okay, we have a heat wave coming in. These are the patients that I'm helping take care of that are most vulnerable, most at risk. How do I use that information to then alert them to take preemptive steps in caring for them so that they don't end up with ending up in the hospital or worse outcomes? On the context of resilient systems, we need to really think about how data informatics connects our public health infrastructure with our healthcare system. And different countries do this better than others. In the United States, where we have a very federated model, there's a lot of disconnect between healthcare systems and public health agencies. And when we look at a big global challenge like heat, this is a huge opportunity. Communities like the Pacific Northwest, Seattle, faced a challenge a few years ago where, because of a heat wave, a lot of elderly individuals and vulnerable individuals ended up going to the emergency department with heat-related illness, and instead of being redirected to cooling centers in the community, and it led to overcrowding of hospital emergency rooms or people coming in with strokes and heart attacks were not able to be seen because of that challenge. And finally, with the area of understanding and advancing knowledge, we have a lot that we can learn from in connecting the data of environmental factors with those specific clinical outcomes. So thank you very much. I think this provides a really powerful lens through which to understand these challenges, and feel free to reach out. Thank you very much.
Thank you so much, Chethan, for bringing this perspective. And now I would like to invite to stage our speaker, Philip Webb, coming from Respiratory Innovation Wales. And Philip is the healthcare professional with experience in both NHS and industry, so bringing those two words together. And I love the title of this presentation, the speech, Let Them Eat Cake, the Future Tense of Air Quality. So yet another perspective from Philip.
So thank you very much for the opportunity to present. There's a couple of things I'd like to start off with, really just to get it off my chest, okay? So the first thing is there is no I in team, okay? So hopefully you'll see my team there. My team allow me to be able to talk to you about the stuff that I'm about to talk to you about. And for everyone who's online, particularly if you're of an Australian persuasion, I'm Welsh, right? So I'm very sorry that I've knocked you out of the World Cup. It's okay, it comes around every 4 years, right? So don't get too hung up about it. I've entitled this, Let Them Eat Cake. This is a quote attributed in the 18th century to Marie Antoinette, okay? So let me set the scene for you. Okay? The French Revolution is happening, right? People are revolting, and people are rebelling because they can't find basic food. They've run out of bread, okay? And somebody runs up to Marie Antoinette and says, the peasants can't feed themselves. And she responds with, qu'ils mangent de la brioche. Let them eat cake. And my view of this is that that's, I think, where healthcare has got to. We're not concentrating on the things, basically, that affect human life, okay? We don't talk about air quality enough. We don't talk about water quality enough. We don't talk about food deprivation enough. We don't talk about smarter buildings where people spend most of their time in, either in places of work or in their homes or in public spaces. We don't talk about energy, but we will spend billions of dollars fixing up problems that are caused by something else, because that's the way that our systems are designed. And that's one of the things fundamentally on sustainability that must change. We must be able to talk about things that fundamentally impact Mrs. Williams down in the Rhondda and somebody living in Africa in the same way that's affordable and deliverable at scale. So I don't think that we need to not talk about people having the basics, and I think the let them eat cake attitude is a function of modern society, unfortunately. We do a lot of things in respiratory wells, but I'd like to focus on indoor air quality and indoor environment quality. And I'm going to make this really uncomfortable for you. So, hands up, anyone who would like to take a swig of that, right? Even in the virtual audience. Would you like to take a swig of that? Okay. So if you don't want to take a swig of that, why are you happy breathing it? Because that's in effect what you want to do. And I'll give you a little bit of statistics around this, okay? So I have somebody with a young child in the back that I spoke to. Hi, can you stand up and introduce your daughter to the audience? 3 months old, okay? So fact number one, Sarah's future is going to be determined in the first 36 months of her life. Both her health, her wellness, her wealth, and how she lives in the first 36 months of her life, okay? And if you're going to get Sarah to start breathing in that, her first 36 months aren't going to be good, and the rest of her life won't be good right from the beginning of her life, okay? So if you didn't know, I'll be surprised if people... How many people would acknowledge the fact that poor air quality killed more people than COVID? Did you know that? Poor air quality kills more people than COVID. And if you look at the WHO statistics, 99% of the population lives in areas that breach WHO current standards for air quality, okay? So How do we let something like that happen? Why do we let it happen? The UK government spent £460 billion on COVID, okay? I'd hate to think about how much was spent with COVID internationally, okay? Do you hear news about how much government is spending on improving air quality? Right? How many of you have seen that? I've seen that on TV here about how much is being spent on COVID. It's really interesting about this because it relates to the way that people look at it and not being aware of what this really means to people. So it kills more people than COVID. Nobody really spends a bean on it in terms of air quality. And yet it's something that you're passively taking in all the time, right? You don't have a choice about air quality, you're breathing it, and you've got no way of monitoring it. So if I had an ability and an innovation to show you black spots in areas around the air, okay, most people would avoid the black spots, but I'm not even giving you the opportunity to be able to do that, which is a really sad situation that we're actually in. And interestingly, this type of deprivation, air quality deprivation, affects our youngest, most vulnerable people and our oldest, most vulnerable people disproportionately. So we have had excellent conversations about what it means to live well and age well. Yeah, I think looking at designing air quality better allows you to do that in a way that's invisible to people but provides them with benefit. So keep that in mind. The other thing to say about air quality is that indoor air quality and indoor environment is the white elephant in the WHO. Outdoor air quality standards have been in place for some time, but interestingly, they don't reflect current exposure science. So WHO have got guidelines, which they've tried to do the best with the science that they had, but they need to be updated. Nobody knows anything about indoor air quality, really. And if you look at some of the studies that I'll talk about, it's quite shocking the impact on actual mortality and health and well-being that even small amounts of toxicity in the air can actually produce to you. So the first WHO conference international on air quality was only last week. So it's surprising that something, and I'll go why it's surprising, hasn't actually been discussed in terms of the health impact, the wellness impact, the impact on people's living, and importantly on an economic impact. Now, this is a test. We've had people talk about the impact of climate change on our flora and fauna. It's actually an intelligence test. So I had a bunch of medics and I said, what is that? Okay. Do you know what the answer was? It's a frog, right? Now, the top 5% of people who are trained and educated thought that was a frog. Would anyone hazard a guess what that is? That is actually a frog, it's correct. It's the hourglass frog, and it's the latest species to die out due to climate change. The reason why I'm putting this slide up here is because not only is it a bit of a crisis in terms of what's actually been lost as a subject of climate change, we still get 12 to 30% of our new medical discoveries from the natural world. So not only is it an issue about the types of biodiversity and flora that we've got, we're actually cutting off our supply chain to the latest discoveries that we've got to help human health as well. So it's a double whammy for us. I love this slide because it tells me what human beings are actually like, right? So as human beings, we have a really bad tendency to wait for a car crash to happen rather than doing something about it. And this applies to mostly everything that we do. So my call to action is, why are we waiting for the car crash to happen when we know we can do about it? We've already had a conversation about it. It's not the technology and it's not many other things, it's just human behavior. So I'll talk a little about the data science. So the first thing to say about it is data science in air quality is a huge data analytics issue. There's massive amounts of data that we can use here to actually inform us about what choices that we're actually making, both on an indoor basis and an outdoor basis, and it needs to be filtered into public health programs. The reason why indoor air quality is really important is that as a society, we spend 93% of our time indoors now. So we unfortunately, whether you like it or not, are part of the Simpsons culture, right? We spend our time in cities looking at digital applications called TVs or streaming online. We don't go out, and we spend the rest of our 6% in cars, okay? So if you can't get the indoor environment correct, okay, there is no hope that we've got to have a healthy and well nation. And this is my final slide, okay? This is my dog. The look she's giving you is the look that she gives me when she wants something done. And my call to action is, this is entirely affordable. Solving this problem out indoors is pence per square foot. pennies per square foot. And it affects things like sickness and absence rates, wellness of people living in buildings, aging well and living well and thriving well when you're younger. So my issue is, at the back of all of this, what are you going to do about it all? Thank you very much.
Thank you, Philip, so much. I think today, or at this session, we are hearing a lot of call to action, what we are going to do about all this. And I will want to take it during our discussion. But before we go there, we have one more speaker. We have Prasun Mishra, founding president of the American Association for Precision Medicine, chairman of WISE Capitals. And Prasun will talk to us about driving a change in the society through the global sustainability impact investing. And with Prasun, we will then close this block and we will then speak what we all can do together. So Prasun, please, the floor is yours.
Thank you for that kind introduction, Carolina. And I think what I'm going to talk about is going to bring everything, together actually. So ladies and gentlemen, esteemed delegates and fellow panelists and distinguished guests, those who are present, here and watching virtually, especially in Europe. If you guys are still up in the night, actually, thank you very much. So, we all know that in the world facing unprecedented health and environmental challenges that are evident by the pandemic and other challenges, mental health challenges and other things that we have seen, the intersection of healthcare, precision health, and impact investing represents a beacon of hope and for a better future for all of us, actually. So the title of a talk, as mentioned, is I'll talk about driving change in society through global sustainability impact investing. Before we go into that, we all have heard today that there is a very, good link between health and environment. So our well-being is intimately tied to the health of our planet, and the air we breathe, the water we drink, the food we consume, and all the products of our environment. It is therefore incumbent upon us to safeguard our planet's health. In doing so, we represent and enhance the health of our own, actually. So. I lead an organization called American Association for Precision Medicine, and the goal of the organization is bring the 4 P's of precision medicine. Everybody's talking about P's and C's, and so our 4 P's are basically patients, providers, public health planners, and payers, actually. So we bring together and try to catalyze the dream of accelerating precision medicine and transforming patient health. So from precision medicine is basically started as a drug diagnostic combination. So we are now treating right drugs for right patients for right time, but then overall we have moved on to learn that not only we focus on treating patients, but also how do we focus on keeping patients healthy. In particular, the dawn of precision public health basically shows that where we live, what air we breathe, what is the pollution level, what are the disparity level, it all affects our health, actually. So now we have to, as a community, we have to basically look at health at a larger glance. And as a lot of states in U.S. have already implemented, including California, the value-based care, where you are not only incentivized to treat the patient, but also keep them healthy, actually. So from the beginning. So one of our goal is how do we scale value-based care in different states in U.S., actually. So, now let's talk about impact investing. And impact investing is a visionary approach, that I think believes that that also not only believes on the returns, but also what impact it creates on the society, actually. And we as a group, we decided to basically, focus on sustainability because health and well-being for all basically touches upon majority of the SDGs. And once we started looking into it, we realized that in 2007, UN launched 8 Millennium Development Goals, and it could not achieve them, actually. Then in 2016, the 17 Sustainable Development Goals were launched. And again, due to COVID and other, other factors, we are still very far in achieving them. And then we're trying to brainstorm what is the major cause why we are creating goals and are not achieving them, actually. And then one of the echoing thoughts is the lack of public interest from the investors, actually. So what we delved into is creating a community of investors, actually, and so these are funds and high net worth individuals. It's called Wise Capitals, actually, and initially it started on investing in healthcare companies, actually. These are so pharmaceutical so drug discovery, development, diagnostics, digital health, medical devices, actually, these companies, and then it eventually grew into basically in other sectors. So far, our focus is good health and well-being, and whatever affects the good health and well-being. That includes, food and agriculture. That's zero hunger, quality education, and as well as energy and environment, actually. And there are some indirect impacts on other SDGs as well, actually. And our main focus is that healthcare is intrinsically connected, actually, and to other sectors such as agriculture, education, energy, and environment, actually. And if we fix this, or at least we drive investment in these sectors, I think we will have a transformative change in society. So our vision is basically we are on to reducing infant mortality rates, create affordable diagnostics and treatments, and COVID showcased that how important that is, actually. Preventing healthcare and providing access to nutrition, nutritious food, organic agriculture, modernization of smallholder agriculture, employment and empowerment of youth and women, actually. Innovation and R&D, actually, in biotechnology, agriculture, digital health, as well as mainstream, creating mainstream eco-friendly consumer goods, carbon offsetting that we heard today, climate smart energy solutions, creating smart energy solutions, accessible and affordable primary education, skill development and capacity building, and higher employability. So increasing the employability of the folks, either young or elderly population. And in conclusion, achieving sustainability development goals, actually, would have a spillover effect, causing a ripple effect on our society, actually. So this my call of action will be that let us all become advocate of impact investing, and let's work together to drive this change, because I think public sector interest building as well as engagement is very, very important to drive successful accomplishment of sustainability development goals. Thank you. Thank you very much.
Thank you so much, Prasun. So now we heard from 6 practitioners and experts in the area of sustainable healthcare from different perspectives. And actually, I would like to invite you all to the stage. We have Toseef with us, and I would like to invite you, Cassie, Shane, Chethan, Prasun, and Philip. I must admit that after Philip's presentation, I just keep thinking about the air quality in this room. And I checked that, we all can check in our phones what's the air quality in Manhattan. And we know that it's moderate. It's worse than it was yesterday. But yeah, we don't know. We have to trust that it's good here. We will be still 20 minutes in this in this room, and then we can go. Thank you so much for your patience, and thank you all for sharing your stories with us, your experience. Maybe before we start, I still because I feel very pumped and very, inspired and ready to, to act and to do something. We had a question from David at the beginning, how do we feel? And I wanted to ask you if we feel, because at the beginning when we heard all the stories about the climate change and our Earth being destroyed, I felt pessimistic. Now I feel very optimistic after hearing your stories. How do we feel? Do we feel optimistic? No? Yes? Optimistic? Pessimistic? No? You are not, you're pessimistic, you're not optimistic. Why you're pessimistic? Yeah? You said, no? Because of air quality. Okay. So now everyone is thinking about air quality. Thank you very much, Philip. But yeah, not about your dog, but about the air quality. But maybe one question that I wanted to ask you, all have the microphones, and one question still coming back. I don't know if any of you were here at the beginning when we were opening today, and then Brian O'Connor, our chair, spoke about the value of collaboration and actually the need of collaboration. And all of you, one way or another, touch on this. Also, Toseef there in Kenya, about how important this is to build partnerships, work across sectors, engage. And I would like to maybe hear from you, not the success story, but what was really difficult. Do you have some story to share what was difficult to actually engage in partnership and convince the others that what you are doing is actually, or what you promote, what you advocate for is important? Okay, Shane, yeah?
I could start. So
I think it's working, yeah.
we're good? Okay.
Yeah.
So collaboration's key for really everything we do. My presentation on the Sustainable Program Framework, we didn't come up with that. We work with organizations that aggregate hospitals and health systems like Practice Green Health and Healthcare Without Harm, that we view each other as collaborators and not competitors. So we are on cohorts, best practice organizations, really teaming up and sharing best practices, innovations, ways to get over barriers, suppliers to work with, things across kind of the gamut of everything that we're working on. So we talk about not recreating the wheel and building on each other's successes. And that's something that, can be inspired through healthcare and across industries as well. So something that we really hold near and dear because we've learned so much. So we hope to, put some of that back out in the industry, across industries.
Okay, some other perspectives, some other voices. Was there something difficult on the way?
Yeah, because I don't think that this particular issue can be solved by healthcare on its own. Can't be, right? And what I mean by that is that there needs to be a much more social collaboration between industry, manufacturing, academic partners, and importantly, citizens. Right? Citizens end up being the consumers of a lot of the stuff that we've talked about. Unless citizens and behavior change happens, nothing's going to happen around this. So we need to do it in a way that citizens understand what their choices truly are and make it very easy for them to make the right choice. At the moment, the incorrect choice is option A. We need to change that dynamic and make sustainability the easiest option to take, which means it needs to be affordable and economically viable for all parties interested.
For sure, and I'm sure also that applies to the hospitals. Maybe one question to Toseef also. How do you said that you had this inspiration came to you when you were in the forest, but how did you convince your staff, your colleagues, and we also, as I mentioned in the introduction, that the awareness among the healthcare professionals is not that great, and we were convinced that the healthcare sector is special, and we should maybe not put more pressure. Do you want to share your
Yes, sure.
experience?
Thanks for that question. And I think a lot of challenges exist whenever you're approaching something, and any change that you make, there'll always be resistance. And of course, in this part of the world, we always have challenges of funding and resources. We have budget constraints, we have organizational behavior. But I think when we talk about engagement, we should not only focus on engagement with external stakeholders, but also within. What we noticed is that when we were trying to, push the sustainability agenda at at the hospital, we saw that there was low staff awareness. It's not that they did not want to do sustainability initiatives, but it was the level of awareness. It was low. And everyone wanted to actively participate and commit towards environmental stewardship. But I think what worked for us the most is raising awareness and instilling a sense of responsibilities, even though there were challenges. And I think that level of collaboration, I would say that I'm one of the lucky CEOs from that perspective. We did not have a major challenge in convincing staff to engage with us on water conservation efforts or energy efficiency efforts or even waste management. Thank you.
Thank you. I think, Prasun, you wanted to add something also?
Yeah, I just wanted to add to the previous, previous question. For us, the challenge has been the data sharing, actually, within the collective, because data has been in healthcare considered as a sacred, and then there are several data silos. So we have at our end worked to see how we can, create a platform for data sharing for, for a variety of collaborative purposes, actually. Yeah.
And I would echo the data sharing issue. I think all sustainability really boils down to transparency, and there's not a lot of that within the healthcare supply chain, certainly. It's hard to collect the data to do these life cycle assessments and carbon footprinting. Partially it's that, the contracts that hospitals have with their suppliers actually forbid them from disclosing how much they pay for their supplies. So there's a lot of issues kind of inherent in the market that make it more challenging. But I would say overall, I've been doing this for about 10 years now. And when I started there, I'd be in an operating room talking to people and they'd be a lot more like, why do you care? Why do you do this? And that's not what I'm seeing now. Everyone wants to do something. They just may not know what they can do or how they can do it. And so that's a little step of encouragement in that I don't have to justify my work quite so much anymore. Everyone kind of seems to understand why we want to do it.
Yeah, and I'm sure that there is also a big need for information, like for sharing those experiences so that the others will know where to start and will not have to reinvent the wheel. Chethan, do you want to add something?
Yeah, just building on this theme, I think there's a lot of people who feel like it's maybe not within their scope of work, particularly within a healthcare organization where a lot of people might feel like there's a certain lane that they're in, but they might be personally motivated by sustainability or looking at climate and health. But when I first started bringing this up within the informatics community, it's a lot of folks who work on the electronic health record, on apps and data. There's still I've been engaging folks for maybe about the last 2 years in this topic, so not as long as Cassie has been in the space, and still have recognized a lot of people who feel that this is not necessarily their scope of work. But at the same time, I think as we start to make those opportunities and connections more apparent and try to identify how, some people might be really interested in sustainability, but someone else might be really interested in the health impacts of air pollution. And these are interlinked issues, but in the practicality, they might be different fields of work or spheres of work. And I think building those connections and capacity across to get people from a broad range of interests being able to work together, I think is creating more momentum and catalyst for change.
Yeah, I was about to say, part of this is understanding the nature and relationship between legislation and policy and what can actually be done, right? I would hate for the audience to think that the answer lies in politics, because it does not. Politics will fail us in this quite dramatically. Even in Wales, so we've got a Wellbeing of Future Generations Act, we've got a Clean Air Act, there's about to be a new Clean Air Act and the right to clean air that's currently in the House of Lords. Those are legislation that people will try and implement, but will fail to implement because implementation is a long time. The kicker for the industry, particularly for the construction industry, is that there is a new BSI standard, which is 4102, which is going to be launched in February. That makes it mandatory for people to build non-domestic buildings, commercial buildings and public spaces according to standards. Every single building that we've been in, including new buildings, has currently failed those standards. But what it does, it allows litigation to come into play. So rather than people trying to apply legislation, people will start suing people who own buildings for poor air quality that affects their health. And that will change the industry more so than the legislation will, because it becomes a financial liability that people have got to run with. And what we're saying to people is they need to get ahead of the curve because that's the bit that's going to make the construction industry change its practice overnight almost, because they will get sued if they don't.
I think that brings me very nicely to the other question about the scalability and how to actually make sure that those initiatives that you promote, you started, you pioneered, and you championed are not implemented just in the individual hospitals and based on your wish and will and drive, but how to actually make them more popular, and not only in your setting, but also in a different settings around the world. So what would be your advice, thinking also about the other maybe low resource settings? What would you suggest? Okay, so you said standards, maybe not legislation, but some standards.
I'll be short, right? The weird thing is this isn't expensive to do, right? This is not a massive drugs program that costs multi-billion pounds to do and 10 years to do through R&D, et cetera, okay? Low income communities, wherever they are in their world, can implement this now at pence per square foot. What it is, it's a surprising and tragic situation, and people aren't aware that they can do this and that the technology is already available. That's the bit. I think, going back to colleagues' response, if Memorial Sloan Kettering, which is one of the leading oncology centres in the world, realised that actually protecting the environment for staff working in Memorial Sloan Kettering was as important as it was, for the price that it's going to take Memorial Sloan Kettering to resolve this from an air quality perspective is peanuts. So I would have thought the business case is ultimately very easy to make and very easy to deploy.
And I think even building on that, and that's exactly what we do. You know, in the design and construction of our buildings, indoor air quality is imperative for us, because that is the health of our occupants, the health of our patients, and then who spends the most time in our buildings is our staff. So they're one of, our primary stakeholders in that protection of health. And from this end, really data empowerment, showing the value add. Sustainability is healthcare. What we are doing is protecting health. We put business cases against it. We show the tangible impacts on health. We at MSK avoided over $10 million in costs last year through energy efficiency, waste management, and diversion and procurement related initiatives that have sustainable aspects associated with them. So when you show that, it can really take off, and that speaks to really anyone.
Data and the evidence, yeah?
Yeah, and just building on that theme, I think it's being able to advance the data to how we see the greater benefits across our healthcare economic model. So extending beyond the hospital, thinking about how we can use preventive data, like to know if there's a heat wave or air quality data, how can we advance preventive care so that people don't end up in the hospital in the first place? And that is within the financial incentives of payers, for example, where they are looking to see how they can actually put more money into preventive care related to climate and environmental factors. So ultimately, I think trying to figure out how these initiatives through our advancing of data and understanding can connect to sustainable economic models, but our economic models also need to be shifting to be more sustainable with the planet.
Yeah, and I think your point on scalability actually in companies and solutions, I think engaging stakeholders actually, we can make, products in our minds and get excited, but they have to be, in the field, they have to be implemented and tested and tried. So I think sometimes when the stakeholders come, actually, I have seen the companies pivot actually after the pilot is done or so then the company, the product was something else, but they pivoted and became something else actually. So that only comes after you are in the field and doing kind of trying and testing that product out, especially if it requires physician engagement, engage the physicians early on. Don't wait because it's a physician who can tell you that the value of that product. That's just an example.
Yeah.
I would say, coming back to his core, like if we each individually are asking like what can we do, what can I do? I think the most basic thing is just communication, right? Like telling the story. That's how humans have been communicating, sharing information for forever. And so even if you have a really small sphere of influence, you're not in charge of MSK's sustainability program or, whatever sphere you have, you do have some influence. And that could just be talking about your interest in climate change, air quality, whatever it is. and just help building that awareness. I think that's so crucial and something that we kind of forget. Sustainability in the healthcare space is not well marketed at this stage, right? You're not putting up billboards saying how sustainable you are. I don't know if that's of a benefit, but it's just showing that, it's kind of nascent still, that people don't even, I think a lot of patients aren't even aware that it's a possibility. And we used to kind of ignore the patient voice, I think, in all of this, because what choice does a patient really have in the care they're seeking? However, I have talked to some students of mine who have chronic conditions and are upset about how much garbage they're making and whatever else in the treatment of their chronic condition. They feel guilty about it, just like I feel guilty flying around the world to give these kind of talks. But we shouldn't let them languish in that guilt, right? We should give them better options. We should talk to patients about this kind of stuff. And I think just that communication is so important and something that everyone can do.
Thank you.
Yeah,
and then, just shortly, and then I would
one more C is competition, actually. So you have a competition, you only, and then you have to have a very good fundraising strategy, actually, because if the competition wants, they will acquire you. If you raise money, you acquire them, actually. So it's a.
Thank you. And then Toseef, what's your view on this? How to scale it up? What's your experience and advice?
I think labeling it to say that low resource settings cannot replicate everything that comes in from the high income and high resource level countries. I think everyone can make that level effort. It is a transformational process, and the commitment is what matters. If you have a resolute commitment to sustainability, and it can drive transformative change, every hospital, regardless of its size or location, will have a role to play in reducing its environmental impact.
Perfect. Thank you so much. And then to close this session, I would like to welcome back to the stage David to just for one closing word. So we were talking about the Summit for the Future that will be called by the UN next year. And David, you're a journalist and you reported on politics and you reported on science. So if you can tell us what message, what story would you write from this session that would then be read by those representatives, the delegates going to the Summit for the Future?
Well, I think what I'm hearing is, a real sense of urgency and, this need for collaboration. I think it needs to be sped up, possibly even more than what we're saying here. I mean, this is an all hands on deck situation here. It's an existential threat to the planet, but also obviously to us as part of that planet. So I think that's what I'd write about. I moderated a panel at a UNICEF meeting last week in Climate Week. And it was interesting because they did a survey of young people between 16 and 24 around the globe, what they felt about climate change. And about 70% of them were eco-anxious, as they said. Okay, not surprising. In fact, I'm surprised it isn't even more. It's about 60% of them, though, were eco-optimistic. So I voted twice. I voted for optimistic and pessimistic. So this is, I think, where we are right now. I mean, we don't have a choice but being optimistic that we are going to fix this. But I also think that we have the capability as humans to do this, right? The brilliant work you guys are doing, everything that we've heard today. And, the question is a timing issue, but that's what I'm actually literally writing about. I mentioned it quickly in my talk, but we as humans have almost uniquely evolved, as far as we know, among species, as I said, to learn from our mistakes and correct the future, plan for the future. And we know how to do this. We actually, have the solutions, but we need now the willpower to do it. And I'm seeing, having been a part of, small part of Climate Week last week here in New York and feeling that energy, I think we're at a threshold, and I hope we are at a threshold. And it's really just a timing issue.
Perfect. Thank you so much. I hope you write the story about this panel and we can read this. Just to close, I see that my colleague Bledin wants to give you some message, but one fun fact about me, I'm Polish, but I'm also Finnish. And actually last week, the president of Finland, Niinisto, was speaking at the UN. And he said that, of course, there is always so much frustration in the room that nothing is being done, and but it's actually our own responsibility to do something to make sure that the system raises to the occasion. And I think that our speakers and all of you are the best examples of those doers and carers. And I would like to thank you so much for your time and for your effort, your work. And I hope that thanks to this event and other opportunities when we have we can convene and share your message, and your work will be spread and scaled up. Thank you so much for this session. And okay.
So we talk about the ECH Alliance about we do stuff, we don't talk about doing stuff, okay? And we disrupt. So first thing you're going to agree to is you're going to allow us to exchange your emails with each other. Because actually, okay, we believe that particularly in the green agenda, okay, there is absolutely no reason why hospitals should be reinventing the wheel, why those of you who are academics and scientists should be reinventing the wheel, that this whole agenda lends itself to actually having one way of doing something and sharing that globally. And when we decided to do this Science Summit, we were determined that we would actually come out of it with some positive actions, particularly ahead of next year's Summit of the Future. So in the morning session, I challenged my group that actually we would come back next year and we would have done stuff. So the same challenges to you. You're going to have done stuff. And what you're going to have done is you're going to have created some, I don't know whether it's going to be a book or a manual that says, here's some of the best practices that we've seen, so that we're able to actually circulate that. And again, earlier today, we had Africa Rising. And I'm just so impressed that we've got Toseef, who is the chief executive of the hospital in Africa, up at almost, I guess, now 1 o'clock in the morning. And actually, there are 3 of you here from hospitals. So I actually want to see the 3 of you putting in some hard yards around actually how do we promote this to other hospitals in Africa, other hospitals in Europe, other hospitals wherever in the world, so that we actually leave here with some positive steps that we can take. So I hope you don't mind my being a bit pushy, but I just figure that, you've got to be pushy if we want to change stuff. And you all appear to me to be people who are motivated to actually make a difference here. And that's what we're trying to do. So with that, we'll end for today.
Yeah.
Thank you all very much.
Thank you so much.
Toseef.